So this next video is on how to do a quick upper limb neurological screening clinic. So we start off at the top, so obviously the shoulder girdle. So that would be C5 to C8, and that basically C5 for the abduction, C6, 7, 8 for adduction. So the shoulder and the elbow are C5, 6. The posterior elbow is C7, C8. And then as we go down from the elbow joint to the wrist joint, we come down one. So instead of C5, 6, we go C6, C7. And that is the same for wrist extension and wrist flexion. We then come down. So if we are then looking at the fingers, so we've gone from C5, 6, C6, 7, C7, 8 for the fingers, finger flexors, extensors, and then the intrinsics are T1. So putting that into practice. So what we're going to do now, open your fingers nice and wide. Don't let me close your fingers together. And we're doing that on both sides, so pushing your fingers apart. Then squeeze your fingers together and don't let me pull them apart. So we're working the hand intrinsics, which is T1. We then put you into this position and we can do finger extension. So push up into my hand, then finger flexion. Good. In this position, so the finger flexion was C7, C8, as was finger extension. So now we're moving to the wrist, which is C6, C7. So you're going to go up just like that and then push up, and you're just testing there, bringing your arms back up. Now when I say go, I just want you to bend your elbows. So that's it. So obviously this is doing C5, C6. So bend, don't let me push you down, and turn your hands over. Don't let me push you down, which is C5, 6 again. Don't let me push you up. And then to do C5, 6 again from the shoulder. When I say go, just bring your arms out to the side, like that, like the funky chicken, and push up for me. And then you can feel there. And then in that position, then when she's relaxed, just shrug your shoulders and down. Got a lower limb neurological assessment. So again, using the work of Butler to help remember the myotomes. So the leg, the myotomes of the leg start at L2, and we think of 4 myotomes per body part. So for example, the hip will be L2, L3, L4, L5. And then we remember it by the first 2, L2 and 3 is the hip. The last 2, L4, 5, is the posterior hip. Then as we come down the leg, we come down a myotome. So from L2, 3, we go to L3, 4, and we do the same on the back. So L3, 4 is at the front of the knee. So at the back of the knee, it's L5, S1. We then go down to the ankle and we go again. So L2, 3, L3, 4, L4, 5 of the ankle, and the back of the ankle is S1, S2. So basically, so I want you to push your big toes up, okay? And don't let me push down. And keep your feet where they are, so the feet are dorsiflex. Don't let me push down. And then relax. And then try and push me away by straightening your knee. Pull me towards you. Good. Push me away. Pull me towards you. And then with the knee, push up into my hand. Don't let me push down. And then the next one. And down. So the next video is where I get to hit Debs with a hammer. So again, I just do my screening for my reflexes in this position. So again, also in that position, you can do the Achilles. And we can so the next part of the neurological assessment will be the use of the straight leg raise. So if we look at Deb's here, she has lower back pain and we say right upper thigh pain posteriorly. So if we do this one, so I'm going to cross it better so you can see. So again, what we generally do is I stabilize at the foot, hand just above the knee, make sure there's not rotation, and then you lift up to the point of your symptoms. Now, if, for example, here Debbie says, oh, I've got pain now in my buttock and the upper part of my posterior right thigh, then we still don't know if it's nerve, if it's other tissue. So to try and sensitize, we can add dorsiflexion and bring it back. So dorsiflexion, bring it back, okay? And then come back down. Just looking at some more of the long tract signs for your neurological exam. So the first one I do is the Clonus. So again, there's different ways of doing it, but basically what you're doing is a quick dorsiflexion. I quickly just get them to relax by doing some gentle movements and then bring them in. A positive will obviously be something like this, or a bit slower but larger amplitude. The next one we can do is the Babinski. So obviously what we do here is on the edge, give her a good tickle, and we want the downward movement. Obviously a positive, which is not what we want, is when they come up and giving her a good tickle, coming up and spreading. So we don't want that. The other sign you can look for is the Hoffmans. So again, in this position with her arm and hand relaxed, you're basically just flicking the dip into flexion. A positive will be if she starts to come in like that. Okay. So the last video you have just seen is on how to do a quick neurological screening of the upper and lower limb, including myotomes and the reflexes, Clonus, Babinski and Hoffmans.